Good evening and welcome to Breast Cancer Now's Facebook Live series. My name's Katie. I'm one of the nurse specialists at Breast Cancer Now, and I'm really happy to be joined later on tonight by my colleague Tom Teeling Smith, who is one of the service managers at Breast Cancer Now, and he will be talking to us together. We will be talking about peer support and how that can help anybody who's had a diagnosis of breast cancer, treatment, even at the end of treatment, how it can be beneficial, how you can access it. Um, just a few housekeeping rules to begin with. Um, just to let you know that this session will be recorded, and there will be a chance for you to put any questions that you have regarding peer support and your experiences, or any questions about that and how you can access it. If you pop that in the comments, we will get through as many of those questions as we can this evening. Any that we don't get around to answering tonight, we will try and sort of reply to them in a few by the end of the week, hopefully sooner than that. Um, if you've got any questions as a result of anything you hear tonight and you want to talk to one of the nurses, we will be back on the helpline tomorrow, and we're there Monday to Friday, 9 till 4. So do feel free to give us a ring on our helpline, which is 0808 800 6000, or you can email us as well at nurse@breastcancernow.org. I think that is pretty much all I have to say at the moment. There will be an evaluation that we'd love you to fill in if you wouldn't mind. Once you've watched us, just to let us know if there's any topics that you'd like us to cover, any ways that we can improve, anything that you like. It's always really helpful to get that feedback. Um, but really, I think without any further ado, in a moment, I'm going to introduce you to Tom, and from there we will talk through everything to do with peer support. And hopefully, you'll find the session really interesting. Hi, Tom.
Hi,
Are
Katie.
you there? Lovely. So lovely to have you on tonight. Thank you so much for joining us. So really, I suppose without much further ado, I think it might be helpful to begin this session just by talking a little bit about what we mean by peer support, and what we offer as a charity regarding that. I mean, it's a massive first question, but maybe we'll just start with the definition of what peer support is, if that's okay with you.
Yeah, of course. Thank you, Katie. And first of all, thank you again for having me. So I mean, I'm sure as a nurse, Katie, you agree. There's a massive place for the support of medical professionals and friends and family as well. But peer support is often, for me, it's overlooked a bit. The importance of it, the big difference it can make to people. So personally, I fully believe that unless you've been diagnosed with breast cancer or affected by breast cancer, you can't truly understand how it feels. And for that reason, people who've been through the disease make very helpful people to talk to. They've got that first-hand experience. They know how it feels to have that shock of diagnosis. They know the challenge of treatment and the impact it can have on the rest of a person's life. So someone who's been through it, they can relate in a way that someone who hasn't been there
Other
simply
people
can't.
can't. Yeah.
Um, and I think in the context of breast cancer, I'm not medically trained, so I have to be really careful. But I think breast cancer is a disease that affects people in so many different ways. You have so many different types, so many different treatments. It affects people of such different ages, different gender. Um, Sometimes a peer isn't simply someone who's had breast cancer. Sometimes a peer can be someone who has maybe been diagnosed at a similar age, similar type of breast cancer, similar treatment paths, or sometimes someone who's simply worried about the same things. And I think there's something reassuring in knowing that you're not alone. Someone who has actually been there, had the same challenges, felt a similar way, and hopefully dealt with those challenges. And I always say that you can have two people that say the same thing to you, but it just means that a little bit more coming from someone who's been there. I've not had breast
It's been
cancer, and
there.
if I was to say to someone, "Oh, you can get through it, keep going, you can get through this treatment," that will mean very little. But coming from someone who's actually been there, knows how hard it is, that just means that whole bit more. And I think that's one of the great things that we do here at Breast Cancer Now. A lot of our services really do put that peer support kind of at high, importance. It's not just about the information or the medical professionals coming to talk. It's about those relationships, those people you meet in those rooms.
Absolutely. And it's about not feeling alone, isn't it? So, talking to other people, as you said, that have been through similar, or even who have a similar family situation to you. They may not have the same diagnosis exactly, but they may have been diagnosed at a similar age or have younger children or caring responsibilities.
Mhm.
And it's managing all of those other challenges that come alongside when you're being treated with cancer as well. So, I suppose one of the services that you manage, and that we refer a lot of our people to, that phone us on the helpline, is our Someone Like Me service, and that is volunteers, isn't it, that have been through breast cancer, and you can match them to match their sort of circumstances and what it is that people want to talk about. So, do you
Yeah.
want to give some examples of the sort of volunteers that we have?
Yeah, absolutely. So someone like me is just one of the services we provide here. We have a range of different services, and I think although we associate, someone like me most of all with peer support is important in many of them. But someone like me is a one-to-one support service where you speak over the phone or by email with someone who hopefully relates to your circumstances, someone who's a bit further on, who's been there too. So the service itself is open to a wide range of people. It's there for both men and women affected by primary breast cancer, also their family as well, their family and friends, and also people with inherited and increased risk. So the most commonly the BRCA genes, but PALB1 and CHEK2 are also obviously very common as well. So we can help all of those people. So I always describe it as like a bank of volunteers, and they are people who have been in those positions themselves. So what we try and do is kind of handpick the person who's best placed to relate to their circumstances. So it's sometimes, I must admit, the name Someone Like Me, it's a very ambitious name, speaking
Mm.
to someone who is like you. But I always stress it's someone who's like you. It won't be someone who's exactly the same. It will be someone who's hopefully similar in a lot of ways. And what we often have to do is trying to kind of work out what that person is most worried about, what's on their mind, first of all. So it could be, for example, for some people, the most important thing could be to speak to someone else who's in their 20s and been diagnosed. Or it could be, in their case, the most important thing is to speak to another woman who speaks Urdu. Or it could be to speak to another man who's had breast cancer. We'd hopefully be able to arrange that for them and be able to handpick someone who's similar to them. Um, and I don't know if you've met any other volunteers before, Katie, but I
I
think
haven't
sometimes
actually, no,
have
yeah,
you not?
but
So,
mm,
I mean, I think sometimes the word volunteer kind of it means different things to different people, but I almost think it doesn't do our volunteers justice because they're just such incredible people, and many of them have actually used the service as well themselves when
yeah,
they were going through their diagnosis, and there's something really lovely about seeing them go through breast cancer and come out the other side and then start supporting other people. But they're incredible people who are happy to share their experiences and um, first of all, just listen. I think
yeah,
to hear what that person's going through. But when it feels right, they're also happy to share a bit about how they managed and how they coped. And that, I think there's something really reassuring in speaking to someone who is doing well now a few years on, because all our volunteers are a few years on, and
yeah.
it's really nice and sometimes really reassuring to hear from someone in that position.
Absolutely. Yeah, and I do hear that on the helpline from people that have had an interaction with a volunteer and said, "Oh, it was really, really helpful." And it was great to hear that somebody that was
Yeah.
diagnosed when they were young. And sometimes that's something else, isn't it? You can be young now, but they could have been young when they were diagnosed and now they're older, and that can be reassuring as
Yeah,
well. So,
absolutely. So we don't use like a kind of an algorithm or anything like that to match people. It's all done by a member of staff who will arrange that match for that
mhm.
person as well as they possibly can. And yes, you're right, Katie. Sometimes we get calls from younger women who actually, we might put them in touch with someone who's now, in their 50s or 60s or even older, and we've done that because they are 10, 15, 20 years on, and that just kind of lifts them right away to hear from someone who's that far past, who can look back at
Yeah,
cancer as a memory.
yeah. And there's no limit, is there, to how many times you can be referred into someone like me? Because
No.
I know that people's experiences and their concerns and anxieties change, and sometimes it can help to talk to more than one person.
Yeah, absolutely. I mean, I don't know yeah, you're right, and it's probably similar to you on the helpline. I mean, we try to be really flexible, so people can call us, the day they are diagnosed, but they can also call us 10 years afterwards as well, and then there's no kind of catchment or time limit on anything. And in terms of the number of time people use the service, sometimes we get people that might want to speak to one person and get to know them really well over maybe a few months. And then we have others who actually find it reassuring not just speaking to one person, but speak to 3 or 4 people along the way. Um,
Yeah,
and what we find as well is that you can, what you're worried about today, it might be very different in a few months' time. So sometimes the volunteer we pick initially maybe won't be the right fit in a few months, and maybe we can put you in touch with someone new,
hmm,
yeah, in that moment.
excellent. And how many times would the volunteer speak to a service user?
Yeah, so we try to be really flexible with it. We always say that no more than once a week, but often there's a few weeks. It can be between calls. Sometimes as long as a month. Sometimes as little as 1 week. But it's really flexible to how that person's feeling. Sometimes people just like a call kind of once a month. Sometimes people once a week is best for them. But it's
Hmm.
really just about agreeing that between themselves and the volunteer as well,
Yeah.
and respecting that volunteer's time. Um, but equally, a lot of people just want one call. So, we're always keen to stress to people that, they're not signing up for something that needs to keep going if you don't want it to. And I think a lot of people will just have the one conversation. It doesn't mean that they're not found it helpful. It could be that in that moment, all they needed was that one conversation, and then they decide to leave the service for a while, and who knows, maybe come back one day.
Excellent. Thank you, Tom. So, I've just had a question come in here now so it's not exactly a question, but Adele says, I don't want people to feel sorry for me, and I find that the hardest part of telling
Yeah,
people.
yeah.
Yeah.
Yeah, I mean that's a really good point actually. I think it was Adele. Yeah, we get a lot of people that kind of say that those people around them just don't respond in I'm going to say the right way. It's probably the wrong word to use, but in a way that's right for them in that moment. You get people who kind of sometimes you get flippant comments or comments that maybe don't mean very much in that moment, even though they're well-meaning. And to speak to someone away from family, friends who you're never going to meet, completely private
Mhm.
conversation. It's just a bit more open and honest and real, I think.
Yeah. Absolutely. Samantha's asking, how would someone volunteer for the Someone Like Me
Oh,
service?
thank you so much. It was a really good question because, yeah, we really do rely on our volunteers, and it's always a constant kind of constant battle between how many volunteers versus how many calls, and it's quite hard to get it right. But what I'd recommend is so our email address is someone.likeme@breastcancernow.org. I'm sure someone can put that in the chat for me. So it's someone.likeme@breastcancernow.org. If you drop us an email, what we'll do is we'll register your interest and we'll contact you the next time we recruit. We've actually just had a deadline on our most recent recruitment, and we're currently just about to start our new round of training for volunteers. So it's probably worth saying that as well, actually, Katie. And that's one
Yeah.
of the things that also separates us from, say, maybe people you meet in waiting rooms and clinic rooms is that all our volunteers we feel are safe people to talk to. They go through it's a bit like applying for a job, really. You go through an application, an interview, an induction training, and only then you can make calls once that volunteer's finished it. So we like to think they're safe people to talk to, people who are kind of ready to take those calls themselves, and also have the kind of the right communication skills to be able to conduct a good helpful call.
Fantastic. Thanks, Tom. Um, and what sort of things do people talk about with a peer? I know we've covered quite a few of them already.
Mm.
I know personally myself, I've certainly referred callers to you to talk about reconstruction, for example, and sometimes
Yeah,
they can talk to more than one person. That's a good example of when people might want to do that. Is that would you
yeah.
say is right?
Yeah,
Yeah.
absolutely. So I think still statistically, reconstruction is probably what the most common reason someone would call someone like me service, and we get a lot of calls from people, as you say, making decisions. So what we would do in that scenario is have a chat with them to work out what's most helpful for them, and sometimes they say to us, although I've got a few options, I'm leaning one way more than the other, and at the moment I don't want to cloud my mind even anymore. I just want to speak to that person who's had an implant or had a DEP,
Hmm.
and focus on that. Other times they actually want to speak to several people who had made different choices, and we'd arrange that for them. So, our volunteers wouldn't tell them what to do. They wouldn't ever wish to, but they would say why they made the choice they did and how their reconstruction is a few years on. So we might, for example, look to speak to someone who, arrange them to talk to someone who had maybe an implant, and maybe someone who had a flap reconstruction, so something like a DEP from the stomach, maybe someone who chose not to have a reconstruction as well. We also hear about option as well, and can kind of get a really well-rounded picture. And then when it comes to make their own choice, we like to think they'll just feel a little bit more informed about the consequences of the choices available to them, and how others have reacted.
Yeah.
But that's just one example, isn't it, Katie? I
Yeah.
mean, there's, with someone like me, I'd say it's the nice thing about it is it's really tailored to what that person is wanting at the moment. So although maybe the most common reason for someone to use the service could be to speak to someone who has had a similar treatment and kind of get some tips and some support whilst they go through that treatment, we also get calls from people who want to talk about things like returning to work, or even should I return to work? I'm not sure I want to do that same job anymore. I want to do
Hmm.
something I enjoy, and I want to speak to someone who made that decision, and why they did it, and whether they're pleased they did. Or it could be that someone wants to talk about dating, and they're worried about having the confidence to meet a new partner. How am I going to have the confidence to go out when maybe I'm not feeling my best physically? And can I speak to someone who was able to do that? Or things like, I could go on, things like fertility and returning to exercise, the impact on relationships. It really can be anything. And the reason it can be anything is obviously because breast cancer can affect so many different areas of our lives.
Yeah, and I know you mentioned earlier that you have people that have had BRCA genes or
Mm,
PALB2,
yeah.
and I know that we had a question that was submitted earlier from Chan that was talking about that got a positive result for BRCA1 recently. What can I do? She needs more information. And firstly, Chan, thank you very much for asking us that question. And it is a complicated topic. So, from a clinical perspective, I think hopefully you will have seen a genetic counsellor or a geneticist that can go through the practicalities of what that diagnosis of that gene means to you. Um, and it can be really difficult to process that. And also, we've got quite a lot of information. I just wanted to sort of signpost you to about family history and managing your risk, which you can have a look at online. But certainly, someone like me does have volunteers, don't they, that have got genes as well.
Yeah.
So, yeah,
Absolutely, and yeah, we can talk about the decisions in front of you regarding risk reducing options, but also just how you're feeling after that diagnosis in that moment, and the impact on
on
family, and
family,
how to talk to people about it. Yeah, and what we
yeah.
hope to do in that kind of situation, Katie, is maybe find someone who's a similar age with a kind of similar family setup because of the impact of the diagnosis.
Yeah. And there are also to say it's not all. This isn't all about the services that Breast Cancer Now offer. BRCA Chat also is a very good organisation, and they offer support as well for people that have been diagnosed with altered genes, and they do online and face-to-face meetups. So it could be worth having a look at their website as well. And there's quite a lot of support and different organizations. I'm just highlighting a couple, but there's an American website called Force, which is Facing Our Risks with Empowerment. And that's an American site, but it does apparently has private groups in the UK, so it could be worth having a look at that one as well, just to see what other support might be available as well if you wanted to talk in more of a group setting, for example. So there are other supports groups available as well. So just going back along, seeing what other questions we've had. So there was a question from Helen, which I think we may have answered quite a lot about. I'm 38 and have recently been diagnosed with breast cancer. I'm thinking about reconstruction, but can't decide whether to have one or not. I don't know what questions to ask. So we've talked about how you can access someone like me, and you can talk to different people that have had different operations and their experiences. There's also an organisation called Flat Friends if you don't know whether you want to have reconstruction, and that's a charity specifically for people that have opted to have a mastectomy, and they do support and peer support as well.
It's probably worth saying about Flat Friends as well is they're not telling people that it's the right option to not have a reconstruction. They're saying it's right for them and right for some people. So don't feel like you can't speak to them if you are leaning towards a reconstruction at all. It's all happy to hear from you.
And other organisations that talk about reconstruction it's Keeping Abreast is very good, and they organise support around the country, so you can have a look on their website to see what they've got available if you wanted to talk to somebody in your area and have a support group that way. Keeping Abreast is another really good charity to look up as well. So going back, I mean, it's also important to say someone like me isn't the only peer support that we offer. I think we focused on that quite a lot already, but we do offer support to other people as well. And if we're talking about, say, for example, Helen that was talking about reconstruction, she also said that she was 38. So we have a younger women support as well, and that's our Younger Women Together support events that we do face to face. We also do online. So face-to-face across the country. There are day events. We have trialled a couple of 2-day overnight events as well. And you can have a look on our website to see how to access that and how to refer yourself in, and the online sessions as well, with lots of speakers that come in, and you can meet with other people as well. That anybody under the age of 45 can access those support events. And Moving Forward is another one. So I don't know if you want to expand a little bit more on those as well, Tom. Yeah.
So it's probably worth saying, first of all, a lot of our services are quite deliberately kind of have target audiences because, as I said earlier, breast cancer, is such a wide-ranging disease. They often have kind of their own targets that things they want, issues they want to help people with. So Younger Women Together is a really good example of that because it's there for people who are younger, who are maybe feeling a bit more isolated as a result and have maybe slightly different issues to when you're older. But Moving Forward is also a really good example, and we know that after breast cancer treatment's finished, it certainly doesn't mean it's all over. And in fact, I'd say we probably get more calls from people after the treatment's finished than we do during it. So Moving Forward is a course that's there for people. It's more about the coping mechanisms and strategies that will help people to move beyond cancer and get back to a new normal life, really. It's not about so much giving information and learning about breast cancer. It's more about kind of dealing with the issues that come up afterwards. And whether it's online or face to face, there are you'll be in a room with other people, and this goes for all of our services really. You'll be in a room with people who are at a similar point, who have had similar worries, who, yes, they might be different in terms of treatment path, and there'll be differences between you all, but they'll be able to relate to your that feeling of wanting to move beyond breast cancer, and that's just a really powerful thing, being sat in a room with people who feel a similar way to you and having similar challenges, and often you'll find people creating friendships and that will last beyond the course as well, which is really nice to see. So yeah, that's a Moving Forward course. As I say, they happen taking place across the country, but we also have the online option as well, which can be great for people if you want to join, from the comfort of your own home, or maybe you live a bit further away.
Yeah. Absolutely. I think there's been a lot of positive comments coming through about the experience, people who've experienced someone like me. There has been one comment from somebody called Leslie who said that she only got one call when she
Oh,
came
okay.
for her someone like me volunteer, and she felt quite lonely because she wasn't offered another call after
Okay.
that. I think really, Leslie, wouldn't it be a good idea if sorry that she felt like that, really, first
Yeah,
of all,
absolutely,
and if
absolutely.
she
So,
wanted any more calls to contact you, would that be the
yeah,
right thing to do, do you
yeah,
think, Tom? Yeah.
absolutely. And yeah, I'll be really honest, Leslie. Sometimes what can happen is sometimes we encourage it. Well, we ask our volunteers to offer subsequent calls. I'm really sorry if that didn't happen. Doesn't sound like it did with you. I know
Mm.
sometimes volunteers worry about putting pressure on people to say yes to another call if they don't feel it's needed, and sometimes that can be the problem. But yeah, if you can contact us, we'd love to see if we can help again. If you're happy to give it another try.
Yeah, match with somebody else. Yeah. Um, so going back on here, I'm just having a look. I've had Helen. So Jane has sent a message in saying, I have secondary breast cancer in my bone and I'm finding it difficult to talk to my friends about it as they seem uncomfortable and like they want to change the topic. They don't seem to be able to relate to my experience. So, I mean, that's another thing to mention, Jane. Actually, we do have a lot of support for people with secondary breast cancer as well. And I don't know, Tom, do you want to go through and explain a little bit about what
Yeah,
we can offer in that
yeah,
situation? Because it can be quite
absolutely.
isolating,
Yeah.
particularly if you don't feel comfortable talking to the people that are closest to you. And we hear that quite a lot on the helpline as well, that people either don't feel confident to explain how they're feeling because they don't want to upset their family or friends, or they feel that their family or friends try and change the subject, which it sounds like is happening with you at the moment. So
Yeah, I mean, I think a lot of people still don't know what secondary breast cancer is and what that means, and that can, yeah, for a number of reasons, it can be difficult. But we have a service called Living with Secondary Breast Cancer that I think I'd really recommend. I mean, it's a chance to meet other people who've had a similar diagnosis. I mean, it's similar themes to what I've said already, really. So
mm,
to meet others and also to hear from speakers that attend. So the meetings again, they take place online or across the country, and you can attend as much or as little as you want. So for some people, they might attend every single month without fail, or attend the online session every month without fail. Other times, people might kind of pick and choose when they feel they need to attend, and when they feel like there's benefit for them attending, and that's completely fine. You can, it's really what's going to help you most of all. And similarly with the speaker sessions that we arrange, obviously different people have different needs and want to learn about different things. So you can also kind of pick and choose which ones of those you'd like to join. So if you want to hear about the session we're doing about exercise, you can go along and listen to it. If you actually don't not so much interested in a session we're doing about, I don't know, clinical trials, that you don't have to attend. It's really up to you.
yeah,
So we do those, as I say, across the country, and we also have a specific meeting and online sessions for younger women with secondary breast cancer as well. Um, um, and the other service that I always like to talk about as well, which isn't spoken about that much, is live chat. So live chat actually is taking place tonight. It takes place on Tuesday evenings at 8:30, and quite late for some, but we find it works really well for people who are maybe working during the day, or maybe they've got young children and in bed by then. And the nice thing about live chat is if you are listening, thinking, I'm not sure if I'm ready to meet people face to face yet. I'm not quite sure I want to open myself up to that just now. Live chat's a really nice way to attend and meet people for the first time, because you don't see them, you don't even hear them. It's all like a text talk type service where you meet with other people.
and how do
So
you
it's
register for that, Tom?
so yeah, it's all on our website. I'm sure we can put a link in. So it's all done online, and yeah, as I say, that will be taking place at 8:30 tonight. And I actually help host some of those sessions, and so I know the women that attend really well, and I have to say they're just the most welcoming people. So if you want to go along and just sit there quietly, that's okay. But if you want to go and ask them questions about anything at all, there isn't a question
Brilliant.
to them that's off limit. They're really open.
Excellent. Thank you, Tom. Um, so there's a few other questions that have come in. So Lorraine says, I'm 44 and I've not come across anyone in a similar situation. I have a single mastectomy after being diagnosed with DCIS. So it sounds like Lorraine could probably access quite a few of our services. She would be fit into the younger women support, because that's for 45 and under, and also um, our Someone Like Me service. And the other thing to say as well is we have a forum, which we haven't mentioned. And when you started talking about live chat, I thought, well, that's another it's almost an anonymous way of talking to people. If you don't feel comfortable face to face or even on a camera, you can type your questions into our online forum, and we have lots of different categories for that as well. So some people do feel a lot more comfortable doing that as well. And
Yeah.
Lorraine, Flat Friends as well, you may find that that's a really useful place for you to sort of access as well. And they have closed Facebook groups there, so you can you just need to sort of, I think you request to join the group, and then the administrators will add you. Um, was there anything else that you would say to Lorraine, Tom?
I don't know. I guess the thing that comes to mind to me is just it's a really good example of breast cancer and how wide ranging it is, because Lorraine's a younger woman, and also the specific surgery she's had, and specific diagnosis are all the important things in terms of shaping kind of how you'll feel when you're going throughout your treatment and diagnosis. And so that's kind of partly why we have our services set up the way we have. So Lorraine, you're really welcome to use any of all the ones that Katie's mentioned, and our hope is that, you said you've not met anyone who's similar to you yet. I'm quite confident through someone like me and through other services that we'd be able to arrange that for you.
Yeah. Um, Emma mentions that her moving forward course was cancelled because there weren't enough people to support each other, and that left her feeling quite let down.
Mm.
Um, that's really unfortunate. I'm really sorry that that's happened to you, Emma. It may be worth getting back in touch with them again to see whether they've rescheduled any. Would you say there was anything else that Emma could do about that, Tom?
Yeah, well, I definitely think get in touch with us, maybe find out when it's been rescheduled. But yeah, just to reiterate, I'm really sorry that happened. Sometimes what can work quite nicely is if you're keen to, say, attend face to face moving forward, maybe perhaps you could look at using someone like me whilst you're waiting to attend the course. And sometimes that can kind of be a really good option whilst you're waiting for something that one of our face to face
Face
services.
ones. And the online ones are running regularly as well. So if geography is an issue and there isn't another one for a while, you could always see whether you could maybe do that one instead.
Yeah, hopefully.
Um,
I'd like to think we'd be able to kind of give you a good idea, or at least a rough idea of when the next one will be, though, in your area.
mm. And Rachel asks why there is such a lack of support once your treatment ends. And I think we hear that an awful lot on the helpline as well. Is once treatment finishes, a lot of people say that they feel like they've been abandoned, their safety net is gone because they haven't got the regular appointments that they had been having with the hospital while they were having treatment.
Mm.
That is one of the main reasons that we have moving forward, to try and help sort of bridge that gap. And So I think that's a really important question, and we do acknowledge that a lot of people do feel like they haven't got as much support once it's over. So that's where
Yeah,
peer support can really come into its own.
yeah. I mean, just to reiterate as well, it's probably one of the more common calls we get here at the charity, and I think sometimes if there's not, that support available for your hospital, it's almost sometimes people kind of feel like they're not, it's just them and that they haven't, they should be jumping for joy that their treatment's
Yeah.
finished, and it just doesn't work that way, does it? So I'm just sorry that there isn't more support there, but hopefully our moving forward course and not just moving forward course, but I think someone like me as well, because what we often do for people who are finished their treatment, and I never like to assume what someone's worried about, but for example, if they're worried about the chances, fear of recurrence is a really common fear for people after their treatment's finished. We'd maybe look to put you in touch with someone who's had a similar diagnosis, but is not just a few years past, but could be 15, 20 years on, and that can usually be really helpful to hear from someone in that position.
Yeah. I think a few people have been asking what secondary breast cancer is, and that would be if the breast cancer was to return elsewhere in the body. So if we're talking about the living with secondary breast cancer groups, that would be for those people with the secondary diagnosis when the cancer has come back somewhere else in the body. It's also called metastatic breast cancer as well, so you may know it as that. So we have a couple of other questions. So I think Jess had sent a message in earlier saying she's got a lot of long-term chemo side effects. When will they pass, and how can she deal with them? And that from a clinical side, Jess, I suppose the chemo side effects do vary from person to person. Most of them tend to be temporary, and they will improve as time goes on. Unfortunately, some people do experience long-term side effects. You haven't actually said what sort of side effects that you are experiencing. So if they are things that you've had for a long time and they aren't getting any better, I would first of all say go back to your treatment team and talk to them about that, just so that they're aware, and whether they may be able to offer you some advice on how to manage them with their clinical side effects. But also to say, I mentioned our forum earlier. We do have chemotherapy threads on our forum as well. So people that have gone through chemotherapy or are going through chemotherapy, they can post their questions and their experiences on that, which can be really, really helpful. So, for example, if somebody was starting their chemotherapy in February, they can join that particular thread, so that people will be going through the treatment at the same time, and they can post the side effects that they're experiencing. If you've already finished your chemotherapy, it may be just using the general forum, or Ask Our Nurse bit on the forum as well for some more general information. And you can always call our helpline as well if you wanted to talk that through with a nurse. And as I said, we are open tomorrow morning if you wanted to talk that through some more. But have you got volunteers, Tom, who have experienced long-term side effects?
Yeah, I mean, unfortunately, we do. Well, depending on how you look at it, but yeah, unfortunately, we do. So hopefully, we could, pair you up with someone who's managed them and can talk about. I'd love to say that that there's a secret in terms of making them go away and managing them, but there isn't always. And hopefully, our volunteers will be able to give practical advice when there is something that they found helpful. But if not, they'll be able to relate to how frustrating it can be and upsetting at times to have side effects lasting, once your treatment is finished.
It's finished, yeah. So this is Beverly has asked questions, and she's been told that her chemotherapy has been delayed as a knock-on effect of the recent doctors' strikes, and she's wondering how she can cope with that. And we do know, Beverly, that waiting for treatment is difficult anyway, and when things are delayed and pushed back, that can be really hard. And we definitely get a lot of people on our helpline phoning up, asking, talking about the anxiety that they're feeling as a result of a delayed treatment. And I'm sure that, Tom, you will have had volunteers that will have been maybe not due to strikes, but having had treatment delayed for other reasons that you may find helpful to
Yeah,
talk to
yeah,
as
we
well.
certainly do. And I think the most common reason we have, because all our volunteers at least a couple of years on, is the impact of COVID and the impact that had on people's treatments. And again, I think there's something reassuring in knowing that delays happen, even as if it's frustrating that it's happened to you, and waiting is a horrible thing. And there's something nice in a way knowing that you're not the only one who's had a delay along the way.
Yeah, and people could help talk about what they found helpful while they were waiting as well.
Yeah,
Um,
absolutely. And hopefully sometimes just having a conversation about what you're worried about can kind of make the rest of your week feel a bit better as well. And you can get things
mm,
off your mind a little bit more, and hopefully that will help, you sleep better and you have a better week because of it.
Absolutely. And Beverly, I'd also suggest that you, just if you haven't already, is to talk to your breast care team to sort of see if they can give you a date for when things will start. Because once you have a date in mind, you can make more plans, and that might make things a little bit more manageable as well. And hopefully they will be able to give you that date now. But I'm sorry you're going through that, because that is really difficult. I'm just wondering if we've got any other questions that have come through at the moment. So I think we may have got to sort of the end of our questions at the moment, but I think that just really to summarize all of the support that we have available would be helpful, and also to mention other places that you can turn to for peer support, if you feel that you want a specific need. And I think, Tom, you've mentioned that we do have volunteers that are men, but also we do work quite closely with the virtual meetup, which if you're a man which has been diagnosed with breast cancer, that can be quite isolating. And we do hear that men often do feel that they are very alone in that situation. And there is this charity that's been set up, the virtual meetup, where men will meet virtually on a regular basis to share their experiences. So that can be a really useful place to go if that applies to you. And Macmillan also, they, it's not just about breast cancer now. We're not the only people that offer support, and Macmillan offer a lot of support as well. And you can also find through there, you can look at in their directory about what's available in your area. So your breast care nurses should also be able to tell you if there is local support groups available to you, and what is around in the area. The cancer care map is another place where you can put your postcode in, and it will say what is available in your area and what might be helpful to you. Because we've talked a lot about talking, but there are other things that people sometimes find helpful, aren't there, Tom? Like doing activities as a group. So the 5K Your Way is something else that a lot of people do find helpful if you want to start trying to get active at the end of treatment. That could be something that you might find that you would engage you, and it means that you can do something as well as just talk. And there are other areas like that as well.
Yeah.
Uh,
There's also, I don't know if you've seen the dragon boat racing teams before, Katie, and
yes.
yeah, just you never think of that, but I think you're right. Doing an activity can, it's not just about doing an activity, is it? It's about the people you meet and the conversations you have while you're doing it.
Absolutely. And I'm sure that I can't think off the top of my head where, but I know there are places that have set up choirs and Nordic walking. So it depends where you are in the country and what is available, but it's always worth just having a chat with your breast care nurse. They will have a better idea of what might be available locally. The library might be able to tell you as well, Macmillan. And then, of course, we've got what else have we got? Maggie's Centre is another place. I'm just trying to think. I've written down lots of things here, but Look Good, Feel Better is another really good organisation for people that have maybe lost their hair or would like some extra support after cancer treatment. So that's a good one to look up to as well. And certainly when I've referred patients there in the past, they found that they've had a lot of peer support from that as well, and met other people in similar circumstances to them. Just one more question here. Lorraine has asked, do you have volunteers with a knowledge of autism?
Yeah, we do. So we have volunteers with maybe they have a professional knowledge for what they do in their working lives. Maybe through their friends and family, they might have loved ones who have autism. So we try our best to pick someone who has an appreciation of what it's like to have autism, if not themselves personally, hopefully professionally or through loved ones.
Lovely. Is there anything else that I've missed or that we haven't covered in enough detail, do you think, Tom?
I don't think so, Katie. But I guess the thing that was coming to me while you were talking is how challenging it can be sometimes remembering which charity does what, and which, even within a charity like ours that has lots of services, which service is for me, and when, and is it online, is it on person? Yeah, it can be really hard to remember it. And I guess the main message is to give us a call, which we know is not easy to do, or you don't have to call us, you could email us if you prefer. But if you were to call perhaps for our helpline, we could have a chat with you about how you're feeling, and what we can do to help. So please don't worry too much about remembering what services
Yeah,
is for me, you know.
there is a lot of services, and certainly on the helpline, we
Yeah.
can certainly go through with you what's available in your area, and I've done that before. We can help you sort of navigate that because there is a lot. You're right. Um, so I think, unless there are any more questions that are coming through, which I don't think there are at the minute, I think we'll probably sort of wind up in a moment. But please, if you do have any other questions and you want to talk to us, or this conversation tonight has triggered more questions, you can always send any emails into our Ask Our Nurse service. You can fill in the form online, or you can email nurse@breastcancernow.org, or you can phone us on our helpline, and we're open from 9 o'clock tomorrow, and we're open 9 till 4 Monday to Friday, 9 till 1 on Saturdays. If you've got a question that you think I really want to ask that now, you can leave a message on our voicemail and somebody will call you back once we're open. So you don't have to call us within those within that time frame. If you leave a voicemail, we will answer. We will call you back. Um, but I suppose that's really all to say from us for the moment, apart from thank you all so much for joining us tonight, and for giving up some of your evening. It's much appreciated, and I hope it's helped. We've got another Facebook Live next Tuesday, and that is on the subject of sleep deprivation and mindfulness. And then on Thursday next week, we're doing another Q&A, a general Q&A session. So if you've got any other questions that you want to put to our nurses, then you can do that as well. If you wouldn't mind filling in our evaluation form, that would be really helpful as well, and we would appreciate that. But otherwise, I think that is all we have to say to you tonight, apart from thank you all very much, and I hope you all have lovely evenings. Take care now. Bye bye.